I've come to learn most families that have watched their child struggle with a mental illness have two things in common.
I never imagined that I'd be standing here today
There are tears.
advocating for the passage of a mental health bill.
And then resilience.
And I know there's no other place I should be than right here for my son, Justin.
Have you ever spoken before a legislative committee before?
No, that was the first.
Tracey Jones and her husband Todd watched their spunky, sporty oldest son take on the world.
Started seeing changes going into his junior year.
Yeah.
Until the light in those vibrant eyes started to dim.
I mean, he took 12 AP classes, he's an AP scholar, that's what's so sad in this whole thing. Is he that now? No.
He can't put two sentences together.
Yeah, unfortunately, the longer you're in psychosis, the more damage is done.
Justin spent 6 years in psychosis. Many of those years misdiagnosed, medicated with the wrong drugs.
One of the side effects of schizoaffect is bad hygiene. And I said, son, let's go take a shower. Oh, Dad, I can't. The razor blades are coming out of the shower head.
Personal experience with our failing mental health system has also given Todd the passion and a purpose to speak as a father and a lawmaker.
Our challenge today should not be, can we cure mental illness? Can we cure substance abuse? Rather, our challenge is, can we at least start?
As a state representative, Todd Jones has worked with Mary Margaret Oliver to present the Mental Health Parity Act. At its core is a requirement that health insurers cover mental and medical treatment equally.
If there's no limits on physical health doctor's visits, well, then there's no limits on mental health doctor visits.
The bill defines medical necessity, the standard by which insurers are held accountable. And for those companies administering Medicaid, 85 cents of every dollar must be spent on patient care.
We understand there's administrative costs. We're not blind to that, but we definitely don't want 83 or 82, which is where they're at right now.
That extra 3 cents for every dollar really make that much difference?
Oh yeah, that extra 3 cents based on last year's spend comes close to $500 million.
Todd hopes all of these changes, if passed, will give people like his son treatment earlier and longer. The Jones shared with the Reveal a list of all the places Justin has received care. 4 states, more than 20 different facilities. So some people would look at that and say, he got a lot of care. I mean, right. What is it that the two of you want?
Exactly. That's what you'd think.
Well, I still remember walking in, he's banging his head against the wall, blood's coming down, and we walk out, and they literally say to us, oh, looks like he's ready to step down soon.
Yeah.
And you're like, I'm like, have you been in that room lately?
The Joneses say what their son got was a repeated cycle of short-term stabilization with no follow-through for a long-term solution.
It's almost like a community developer building 1/10 of every house. You may have poured the concrete on the house, but you never built the walls, you never put in the conduit, you never did anything to let someone live in that home. Well, it's no different.
For periods of time, Justin was homeless. Not truly understanding his illness, he would run away. And each time, Todd and Tracey went looking.
His hair had grown completely out, complete beard. Nails were, literally out to here. And he didn't want our help.
No.
He pretty much was like, if you could just buy me a sandwich, I'll be okay. Yeah. And of course, we bought him the sandwich. Remember the burrito? It's the only thing we could find.
Todd and Tracey say the only reason their son is stable now is because he broke the law. It sounds absurd, especially when you think about it in relation to another illness like cancer.
Yeah, we can't give you the treatment you need for your stage 3 breast cancer, but if you know what, if you go and rob over there, we can get you into a facility.
Yet charged with a crime, that is essentially what happened. Justin spent 7 months in a state hospital, and since he couldn't check himself out of treatment, he was finally monitored long enough that he was able to get on the right medication. Todd and Tracey know the old Justin is gone, and the tears aren't over.
Because Justin, our firstborn, has a diagnosis of schizoaffective disorder, a diagnosis that was accompanied by the words, "I'm truly sorry," from the psychiatrist.
But there is hope. Hope for Justin, hope for Georgia.
Can we at least give them hope? Because I can assure you, going through this 31 times with my son, there were many times my wife and I didn't even think we had hope.
Hope our broken mental health system will be fixed before it damages more of the families that depend on it.